take control of your oral health. So I know all of us have a lot of things going on in our lives, and a lot of times our oral health can get neglected because there's so many other things to be worried about. So today we're just going to focus and shed light on everything that you guys need to know. Before we start, we gave you guys these papers. Hopefully everybody has it. We have some more in the back as well. One side is the pre-test and the other is the post-test. So it's just a few simple questions just to have an idea of what you guys are familiar with. A lot of you guys said you were interested in learning about vaping, a little bit about prenatal care, as well as how to take care of your dentures and bridges. So that's what we're going to be talking about today. And if you accidentally do the post-test, that's okay because it's the same questions. We're just going to be gauging to see if you guys learned anything afterwards. Then the last question is to just list 1 or 2 things you want to know more about. It doesn't have to be vaping, just anything in general, and then that way we can hopefully answer.
Alright, so this is just a little bit about ourselves. Okay, the screen that might not be like the most lit, but we will like read and just present everything you guys need to know. But first about us, so my name's Shekinah. I'm just passionate about like working with diverse populations, and in school we do this things like extramurals. So we're sent out to different clinics to work with different populations. Just recently we were at like the native populations called Shehalah's Tribe Clinic. So ever since like working there, I was just like really passionate about like working with different communities, different diverse populations, because each community, each different person has like different oral conditions that we also have to like fix and treat. And I like experimental ways of like learning and different like studying habits, because I used to be a tutor, so I know like not everyone's the same when it comes to studying. But like the test that we give is just like one way, so there's like a lot of things we're gonna do, like demonstrating, hands-on stuff, and yeah, it's like never too late to learn new things. So that's just like what I believe.
So my name is Adelaide. I'm also a final year dental hygiene student. I'm passionate about preventative dentistry and like reaching out to the community because I moved here from Ghana 7 years ago, and before that I had never had my teeth cleaned. I didn't even know what a floss looked like. So I remember my first encounter with a dental hygienist, and she was asking me how often I brushed my teeth. I didn't really know anything about dental hygiene because back in Ghana no one cares about oral health, you know. So because of that, I'm really passionate about like teaching others, reaching out to others. I want to one day go back to Ghana and like help people out there and, you know, help the community, because most people don't have the resources and all that. So like that is one of my main goals of being in dental hygiene school, so that I can one day just go back and reach out to my community. So that's something I'm really passionate about. I'm also interested in child oral health because I have a 4-year-old. And there were a lot of things that I didn't know growing up. Like my mom didn't know anything, so she didn't really like teach me much about oral health. But now that I know better and I have a 4-year-old, I want to teach other mothers and what to do when you have kids and other things to just help with your child's oral health. Yeah.
I grew up in Spain, so I learned how to speak Spanish. So I'm really passionate about helping people that speak Spanish be able to understand just in basic terms how to take care of their teeth. We also did another like clinic experience in UW Seattle with a lot of patients that had intellectual disabilities, and so I'm really passionate about just simplifying how you can take care of your teeth and developing healthy routines that are actually realistic to your own needs. So there you go. That's us. Okay, so let's get into why oral health matters. So I'm sure all of us have different priorities in our lives, and depending on the season of your life, some things may have been neglected, some other things may have been at the forefront of your mind. So a lot of times our oral health is kind of like on the sidelines. A lot of times our oral health can affect our self-esteem, and even just for myself, I've always been very like just always wanting to be smiling, but there's been a lot of times where I've just been shy with either me talking too fast or just whatever's coming out of my mouth. I wasn't sure what was going to come out, so I would just kind of keep quiet. And so I know for a lot of us we have different insecurities that are related to just our mouth area. Oral health can also affect our job opportunities. So depending on the different jobs, a lot of people can either be discriminatory as well as just hesitant because they'll look at our outward appearance, even though I know that all of us have really hardworking spirits and we've all really worked hard on our discipline. So it's important that we're able to show that we're confident regardless of the way we look and regardless of how the person may be perceiving us. Oral health can also affect us in positive ways. When we're confident and we're able to know what's coming out of our mouths, then we're also able to show that we have the discipline to take care of our teeth. So our hope today is to develop new habits and new routines that will support that. Okay, so could I have two people just share briefly what your guys' experiences were like growing up, what they taught you when you guys were children about how to care for your teeth, and maybe one goal that you guys have for this new year, and what you guys want to change or do differently to continue improving your health.
I remember growing up being taught the importance of brushing my teeth and flossing, and due to me growing up, I used to floss my teeth, and then there was a chunk of time where I was not flossing very much, but I'd always brush my teeth. But it turns out, from not flossing, which is actually one of the most crucial parts of oral care, I had so many more fillings that had to happen in cavities in between my teeth, and I ended up losing a lot of teeth when I got pregnant because of all those cavities and being pregnant. So my goal is to make sure I floss, brush my teeth, use a mouthwash, which is another extremely important part with antiseptic, and to take care of the bridge that I'm hoping to get in the future to make sure it always stays intact and be careful.
Yeah, thank you. It's so informative.
Yeah, for sure, flossing is super important. So getting in between the teeth, because they're so close to each other, then that's where bacteria usually likes to harbor. A lot of times, like at least for myself, I know I could probably be flossing a lot more. Like I'm also not that great at flossing. There are so many different alternatives if you know that string floss is something that's hard to really get into the routine of. So hopefully we'll be able to kind of go over different options so you guys can also try them out at home. We're always talking, so that means that there's always going to be bacteria coming in and out of our mouth. There's always specific bacteria that can cause decay inside of our mouth, whether that be our gums or our teeth as well. So usually, it's usually known that diabetes and smoking are the main risk factors to developing bone loss. And that's mostly because it breaks down your immune system. And so whenever there's a bacteria that that can live in your mouth and not cause any sort of decay, when your body's immune system is down, then it's not able to fight it and it causes more inflammation. And usually when that bacteria sits on the tooth, your body starts thinking that the tooth is the issue, so it will do everything to try to get rid of it. And so that's usually how periodontitis, which is gum disease, is able to cause your teeth to fall out or cause other inflammation in your mouth. And so vaping and smoking, since vaping is a little bit newer, so there's only research in the last 10 years about it, they're not able to say that it's exactly like smoking just because they're doing more research, but they're indicating that it may be potentially more harmful because there's more ingredients that are mixed together and in combination. As we know, smoking requires heat, but with vaping, they said that for the cartridge to heat up, it needs to reach about 400 degrees before it can release the vapor. And so imagine that's like 400, that's like a lot. That's really hot to have in your mouth, especially if it's throughout the day. So dry mouth is one of the major factors that can increase your susceptibility to developing cavities, whether that be in between your teeth or just on the surfaces, because saliva has calcium. And if the saliva isn't fully able to protect your teeth, then it's just basically exposed. And like what we were talking about, the enamel doesn't have anything to protect it. So ideally, we want to have as much saliva in our mouths as possible. So usually vaping can cause dry mouth, especially if you're a mouth breather at night. That also can play a big part in it. So not only is your mouth dry throughout the day, but it's also dry throughout the night. Later, it can also cause a craving for sugary foods. So that means that you're exposing your mouth to a more acidic environment. So bacteria loves eating sugar, and usually it kind of like secretes acid all over the teeth. So it's a combination of having a dry mouth and then having acid that's breaking down the enamel throughout the day. And then also, throughout our lives, the longer we smoke or the longer we vape, or even just snack frequently throughout the day, then usually we'll just be like, well, I like my snacks, I like my Starburst, which is where I was at. So it just kind of makes you feel like, well, I'll just do what I can, and it's hard to want to add a new habit since the ones that you already have are just kind of there. Another thing that it can cause is nicotine stomatitis. Stomatitis just means that it's an infection of the skin, and so it's a little hard to see there, but usually when we're smoking or we're vaping, all of the vapor and all of the heat goes right to the top of the roof of the palate, and that's where we have a lot of different glands that secrete saliva, and it also cleans out our tongue. And so that kind of turns into a rubbery consistency rather than having ridges that's able to clean the tongue and also protect our airway, and that can make you more susceptible to either just any sort of infections that can affect your lungs. And then down, it's kind of hard to see here as well, but in terms of staining, just back to having a drier mouth, then the bacteria is able to trap more chromogenic bacteria. Chromo just means it has color, so anything that is food related is more likely to stick there. And thankfully, most of the time it's going to be extrinsic, which just means that it's surrounding the tooth. So if you're able to come in for your regular hygiene appointments, your cleanings, then they're able to remove it with instruments. So it means that there's still hope for your teeth if you do have stains, but over time sometimes it can go intrinsic, which means inside the tooth, which would require a little bit more than just cleaning on the surface of the teeth. So when we look inside of a vape, there's the cartridge, which has the ingredients, and then we have the battery, which are like lithium batteries, so just like any regular battery. And there's different forms of them, but the main component is the battery part, because when it joins, it creates about 400 degrees of heat, and then that's what's going to create the vapor to be inhaled. So what's really important to know is that it's not just a vapor. So even though they say it's vaping, it's technically an aerosol. So the difference between a vapor and an aerosol, vapor just means that it's like you're heating up water and you're just changing it from water to steam, but aerosol means that it can actually contain bacteria. And so if we're vaping 4 to 5 times a day, then we're exposing ourselves to this bacteria that's harboring, as well as the chemicals, and then we're not able to give our body time to either excrete it or release it, or just to recover from what the chemicals that we're ingesting. So a few different ingredients that were found in a lot of specifically flavored vapes were acetone, so that's what we use for our nail polish, to remove nail polish, as well as nickel, which is in the coins. And then also, have you guys gone to a concert lately? Do you guys like going to concerts? Or maybe in the past? Well, the gas that they usually, like the smoking fog gas, it has the same exact ingredient as well, and that's kind of what makes it look more cloudy. And then also they have some paint thinner ingredients as well. And then there's formaldehyde, which is what they use, if I'm not mistaken, a lot of serial killers use it. And then also just to preserve dead bodies. And so if we think about it, these are a lot of ingredients that on their own are quite harmful, but then if we were to stick that in an air fryer with the chicken, it would heat up quite a bit, and I'm sure the chicken wouldn't taste very good. So that's just kind of a visual to have an idea so that you guys are also aware, like, okay, this is what I'm putting in my body, and then it's up to you guys to think, okay, like, is this something that's going to be working towards the goals that I have for my mom? A few other symptoms that can happen is tooth erosion. So a lot of people, this is kind of like on the side as well. A lot of people can have GERD, so heartburn, and that can kind of cause acid to kind of get on your teeth anyway. So it's kind of like vaping and smoking in itself, we all know, is harmful, but it's in combination with all the other factors that are already affecting our mouths. So usually the insides of your teeth here, and then also where the palate is, and then on the inside is where most of the acid is going to be excreted, and that can break down the enamel and cause sensitivity. So if you'd be able to drink regular hot coffee, then maybe in a few years it will be harder to do so. So it can also affect what you're able to eat and what you're able to drink. And then later, jaw pain as well. The bone loss that comes from periodontitis can also affect your jaw, and so over time it can either cause clicking or popping, and it can also just make it harder to chew on things, which over time is going to be difficult, especially if we're trying to eat nutrient-dense foods and we're trying to nourish ourselves in the best way possible. And then the major or the most important risk factor that is associated with vaping is specifically oral cancer. There's a few statistics where 1 person every hour dies of oral cancer, which is pretty scary. And when we combine a history of vaping and smoking, then it can increase your risk of oral cancer by 4 times, which is pretty significant. So today, actually, we're gonna teach you guys how to do a basic oral cancer screening on yourselves as well as on other people for the future, so that you guys have everything that you need to make sure that your own bodies are healthy. And then also, there's another statistic, thankfully, that there's an 81% success rate when the oral cancer is detected. So our hopes is that today, by the end of it, we'll be able to make sure you guys are fully equipped for the years to come.
We don't have any family in the US, so it was really hard when I had my son, and sometimes like I want him to sleep so that I can go do something else, I can go study, I have to go to school and he's not sleeping. So I realized that as mothers, we tend to just give our children like the bottle, go to sleep with the bottle, because that's what brings them comfort. You give them the milk and the bottle and then they drink it till they sleep. But I realized that was a really bad habit because it doesn't help. So these are just a few things that I want to share with us so that we can just develop those habits with our kids. So one good thing that helps is that when your baby starts to develop any teeth at all, even it just has to be one, you have to start cleaning their teeth. So what you can do is that you can take a damp cloth, just wet it, and then use it to rub around the teeth. We don't have to wait till they have all their teeth in their mouth before we start cleaning. So just make sure you get a clean cloth, wet it, and then wipe their teeth, just to make sure that you are clean. Because they keep eating, they drink whatever, water, they drink milk, and you have to make sure that you are cleaning their teeth. Also, we have to make sure that we schedule their first dental visit by age 1. It says age 1 over here, but you can even start doing it at 6 months old, because at 6 months, they might develop like 2 or 3 teeth, and it might be really hard for you to take care of. So make sure that you take them to the dentist. Usually when they go there, yesterday my son had his dental visit, they took x-rays. They want to make sure that there are no cavities that are building up. And sometimes cavities can really hurt. Sometimes the kids are not able to tell us. You might realize that your baby is crying and you're like, what is wrong with you? You just ate, like you had a nap, why are you still crying? It could be something that you don't know about. So make sure that you're taking them to see the dentist. They are taking those x-rays, they are seeing if there is any cavity that they have to treat so that your baby will be healthy, and you also have your peace of mind. If they sleep, you also have time to go do whatever you have to do. So also, we have to make sure that we are avoiding, sometimes we share utensils with our babies. I do that sometimes, like you feed your child, they don't eat it, and then you put it in your mouth and you give it to them too. But one thing we don't know is that we are able to transfer bacteria, we transfer cavities and all those things if we share utensils with our babies. So what we can do is that we can have like specific utensils for our babies. You have your baby spoon. Don't touch the spoon. I know we can be tempted to like just eat a little bit of what they are eating, but make sure that that spoon or that fork is just for the baby or for the child, and then you also have your special one that you use so that we avoid like transferring those bacteria into our baby's mouth. Also, when it comes to pacifiers, yeah, sometimes it falls down and you take it and you just lick it. Like there's no water around, you lick it and then you put it in the child's mouth. We should also avoid doing those things. And I already said this, but don't let your baby sleep with a bottle in their mouth. That's the most important thing. Make sure that they go to sleep, drink water, and then that's it. Don't give them a bottle. Sometimes too, the baby sleep next to us, and then we breastfeed them. Like we hear them crying, and then we just put it in their mouth, like our breast in their mouth, so that they stop crying. That also doesn't help because the milk has a lot of sugar and all those things. as she already explained, the cavity process, the bacteria likes to feed on those sugar. So make sure that the baby is not sleeping with any milk, any breast milk, whatever it is, bottle, Coke, anything in a bottle. Make sure that they go to bed without anything in their mouth. When it comes to caries transmission to infants, I already spoke about a little bit about this, but cavity-causing bacteria can transfer through kissing and sharing spoons. So even like just kissing them, you might think, oh, this is harmless, like it's just my baby, I want to show them love. But especially if you know you have like active cavities in your mouth and all that, you have to avoid kissing them in their mouth. You can kiss them on their cheeks, their chin or something, and if you get your cavities taken care of, if you get your fillings done, then you can start kissing them on their lips. But yeah, we love them. I'm sure they know we love them, but we have to avoid doing these things so that we are taking care of them as well.
Okay.
Yeah, caregivers also should maintain good oral hygiene to reduce risk to our babies. So sometimes we are looking for the motivation, like why do we have to do it? Even if we don't want to do it for ourselves, we have to think about our kids. Like, I want to be able to do better so that my child will also have a better life. I want to be able to do this so that I don't transfer the bacteria into my child's mouth. So this should be like a point of motivation for us. We want to be able to do better. We want to take care of our oral health so that we can also take care of our child's oral health. And also, we have to encourage family-wide dental care to protect the youngest member of our family. So as I was saying, growing up, I didn't know anything about like oral health, but I feel like as parents, we are in a better position to be able to instill these values into our kids. Now we are learning about this, but usually we have people talk to us. We go to the dentist. They do tell us about flossing. They tell us about how to take care of our oral health. It's very important that we learn these things and we are motivated to do it so that we can also talk to our kids about it. And then one day they grow up and they don't say, my mom never told me about this. I didn't know about this growing up. But we can also do better for our babies.
Okay, so oral cancer screenings, but this is just the basics of what is important and what should we all know, like what we'll know by the end of the presentation. So just a little description of what signs of oral cancer might look like in your mouth. So they can appear like for red and white patches. This is what we call in clinical terms leukoplakia or erythroplakia. So it might also look like spots, but also kind of like a bit of lacy texture around your mouth. And there's going to be a bit of pictures that I'm going to show you on how to actually detect that yourself, like the different anatomy of your mouth where that oral cancer can be commonly found. And also Adelaide's going to hand out a brochure. It also contains like some information from our presentation as well, so you guys can follow along. So usually in clinic, when we look for like oral cancer screening with patients, we use a mirror and we try to look around like every crevice and corner of the mouth. And not just like the surface level of the mouth where we just say, oh, just open up. It can also be detected like deeper in where you have your soft palate, where you can feel that hard palate like more in the front of your mouth, but then we also have to look a bit deeper because sometimes the oral cancer can hide. Sometimes we can say like, oh, it's fine, like we didn't really detect anything, but then that can not always be great because it can progress into something worse. And so it's good to perform monthly self-checks and report like any source if you go to dental offices to say, oh, I have a concern, like this area of my mouth is kind of sore, I've been experiencing it for a couple days, or even just like amount of time you're experiencing it. It's always good to express like what has been hurting in your mouth, even if it's not like your tooth related, even if it's like gum related, on your tongue, or even your throat. That's good because in that statistic that we talked about earlier, that 85% survival rate, once it is oral cancer is detected correctly, that's like the good prognosis of like surviving, since that statistic does feel a bit scary that 1 hour every person dies with like oral cancer is not detected. So that's just another like a good wake-up call, and also good to tell your healthcare provider or even your dentist that there's something going on in your mouth that you're not really 100% sure about. And lastly, risk increases by smoking, vaping, alcohol, and poor diet. Just like all of these in combination can also affect like the oral health in our mouth. Because like in our mouth, in our gums, we have like the different cells, like how it all works to care for our overall health. And so what Halelah was talking about, the different ingredients that also I just learned about today about like the formaldehyde, the nickel, the different like smoking components and temperature. All of those components really interact with like the cells in our mouth. And so that's why with those combinations and including the poor diet and smoking, vaping and alcohol, it can really change like the anatomy and nature of our mouth. So this is where it's like the fun part now. So this is the 8-step oral cancer screening. This is what we actually do in clinic, like in our school. So just by you guys being here, you can actually have it for free, like what we do in clinic. One thing that I did circle is the one in the corner here, which is the side of the tongue, because that is the most common area where oral cancer is found. So when you do like this 8-step kind of oral cancer screening on yourself, I would just like suggest, you just look on like the corners of your tongue, especially when it appears like really red or like that white lacy texture, that what that may not or may not be oral cancer, but once you detect it and you can like bring it to a concern to your healthcare provider, it's good that you're bringing it to their attention. But other than the lateral border or the side of the tongue, there's also other common areas that you could just like look in the mirror. It doesn't take long, you don't have to really inspect, but it's good to like kind of move your lips around, look on the top around your teeth, on your lips. It can be under your tongue or even like down on the gums in your lower jaw. And yeah, and also it's also good to look kind of deeper into your throat, like you kind of have to stick your tongue out and see like around like your uvula area, because that's where the white patches can also be detected as well.
Yeah, just last year, your senior had a patient in clinic and she was doing the oral cancer screening and realized that she saw like that red textured like lesion on the lateral border of the tongue. So she told the patient about it, and the patient went to see her doctor, and it turned out that she had oral cancer. So yeah, I know sometimes we are like, oh, I don't think this is really important, but it really like reaffirmed the fact that these things work, and it's really better for you to make sure that you're doing it daily, weekly, monthly, and if you see anything that looks abnormal, you talk to your primary doctor about it.
Yeah, anything that looks abnormal, but sometimes when it doesn't look right to you, even if like it's not causing you any pain, but if you think like it wasn't been there before, or it just doesn't look normal to you, doesn't sit right, it's just good to like keep that to the healthcare provider's attention as well. So with all of those facts, we're gonna get into the denture and bridge care. So when it comes to denture and bridge care, a bit of last year when I talked about like the denture care, one of the most important aspects was like if you guys are like using removable bridges or dentures, one of the most important things is to take it off at least periodically or when you're going to sleep. Because with the denture, since it's removable, it can harbor bacteria around like the ridges or just like in the denture overall. So when you're keeping that in your mouth with, if you're not rinsing it or brushing it, as you're also taking care of your teeth, that bacteria can grow. And just like the nicotine stomatitis, where that's like the fungal infection, there's also called denture stomatitis. So it's just like that infection that can also happen on the hard part of your mouth, the hard palate, or anywhere like in your mouth that you put that denture or the bridge. That's also removable. And so for these steps, I just showed like a visual. So what we want to do is just like rinse the denture after eating, because there can be like food that's still stuck in there that could like also lead to more bacteria buildup and plaque. So it's just important to like rinse it a bit. And then, but also what we want to do is also brush it daily, like how we target to brush our teeth daily. The only difference is that with a toothpaste that is like non-abrasive, because the dentures are like different from our build of our own natural teeth. So with dentures, it might get scratched easily, and we don't like, that's kind of expensive as well. So we also provided like rinses here just for the denture care that we will give you later. And yeah, so to soak the dentures overnight because that's like a good cleanse. And also to use floss or a water flosser for the bridges to clean under, especially for those like who have bridges or are about to get bridges. There's like those teeth in between that don't have like the roots that go into your bone. So there's gonna be like food under there that's stuck there. So it's also important to like floss under there or get like, yeah. So this is called like the super floss, yeah. So we will show you guys these later, but I don't know if you guys see these. But it's like kind of like a little lasso, it has a loop over. So what you want to do is put it under your denture, which we will demonstrate later better. But you put the floss in and you just tuck it under to put it on the other side. And that's where you can kind of floss your bridge back and forth, since like there's like that space under the bridge. Okay, so this is where, okay, so these are just one of the important stuff when it comes to brushing and flossing techniques. So usually when it comes to people brushing their teeth, they do it like very abrasively, like very rough, like as if they're fighting their own gums, they're fighting their own teeth. But that can also be like very harmful for your teeth, since it could lead to like your gum recession. You can harm your gums. You know, it's like part of you. So it's not like you're gonna fight with yourself. You're just like caring for your like teeth and gums. So just like the proper, one of the proper ways that we suggest at school that we learned is that if hopefully you guys can see that, but you want to kind of tilt the brush towards into your gum and kind of sweep it instead of just going in back and forth motions. Yeah, and Adelaide has floss there to demonstrate later. And it's important to use like a soft bristle brush. We have like some here, but then if you do go buy it from the store, sometimes they will see like hard bristle brushes, medium bristle brushes. You don't want that. That's still like, that's really abrasive for the teeth, but the reason why they would still sell that is because they're making business out of that. And it's just like, it kind of makes you think like harder means like it's good for your teeth, but the softer it is, the better it is. It's still like removing more plaque because like the softer it is, it's able to go into your teeth, in between your teeth, and remove that plaque. And especially with the flossing, we suggest like flossing once daily, and so, I like you. So our suggestion is the C-shaped technique when it comes to flossing. So what you want to do with the string floss, you just want to wrap it around your teeth. She will show you. Okay, because the most common mistake, here, the common mistake when it comes to flossing is that people just put it in and out and they think that's enough. But imagine like the tooth, like it has that like circular texture. So what you want to do is like kind of hug the floss with your teeth. Yeah, up and down. You want to like kind of hold it in, yeah, instead of just like putting it in and out. That's just again another like proper way for like the deplaquing. And so here the last two bullet points is basically is called the disclosing tablets to see like any missed areas. So we have it here, we'll do an activity later. It has like a pink dye. So what's fun about this, we did this in school and I thought was pretty cool, is that when you put like a Q-tip and you kind of paint it around like your teeth, you see like a pink dye. And those spots are like usually spots that you miss when you're toothbrushing or when you're flossing. So those are like the highlighted areas that like gives you more attention, more knowledge, or like where I should be brushing more or where I'm doing a good job at. And so, if there's like other areas that is like really hard to just reach or kind of remove with regular flossing, a water flosser is also good because it can kind of like cover areas that are more in the back of your teeth, so it can reach like to remove those plaque in those areas. Our wellness, overall our well-being is also connected with our oral health. And so when it comes to like dieting and also just lifestyle habits, it's just eating a balanced diet to limit that sugary snack and water intake, and sugary drink intake. Like stay hydrated with water just on the daily. Also when it comes to patients, I've had a lot of patients that had issues with trying to limit their sugary like energy drink intake. I know a lot of us like would want to like drink Coke often, and I don't say like to eliminate that completely out the life, So what I suggest is like, you can do that, but at the same time you want to take care of your teeth and your health. So you can just rinse like with water to neutralize the pH of your mouth. You can spit it out because there are some people that like just don't want to drink water. So it's okay to just swish it around your mouth to keep that normal pH in your mouth. So you don't also have that caries progression. But the last two things, just like gentle reminders, avoid tobacco and alcohol, and recommended to visit the dentist every 6 months.
And also when it comes to like overall systemic health, what most people don't know is that there are statistics that show that periodontal disease or oral disease are related to diabetes and high blood pressure. So if you have like oral diseases, there is a high chance of you to develop like diabetes and other systemic diseases. Also, if you have diabetes and all other systemic diseases, there's a high possibility of you developing periodontal diseases. So like there is like a correlation between those two things. So it's good for us to know that our systemic health also have an effect on our oral health, and our oral health also has effects on our systemic health, so that we make sure that we're taking care of our overall health, everything.
Okay, so how many are we here? Everybody is gonna get their very own oral cancer screening mirror.
You can look around your teeth, your mouth.
And then we're all gonna go
Oh, before the disposing, yeah.
There's more here. I've got, I think we have 20. And then we only have small gloves. But if anybody would like to.
Oh, mirror?
So we're going to do a demonstration, and Shekinah is going to do an oral cancer screening on me. So you guys can kind of like practice on yourselves, or if you guys want to practice with it, if you're comfortable with that.
Thank you.
And then, so Shekinah is going to do it on me, and then Adelaide will explain it.
Yeah, okay, this is great. Yeah, for learning purposes, she's gonna face you, all right? So oral cancer screening. So without the mirror first, what I would usually do, okay, I would tell the patient to open up, just to loosen their cheek a little bit. So because the stretching of the cheek is important, I would look to the side and see if it's clear. And then I would look to the other side to see if it's clear, there's nothing, there's no bumps or anything. And then I would tell the patient to close down. And then now this is where I would look on the top, and then I will look at the bottom here. At the same time, I'm not just looking, I'm also feeling. So I tell the patient to open, and I would like palpate around because there are tender areas you might not feel. So I would like kind of like push down on like her bone, her alveolar bone, which is just like the surrounding structure of the teeth. And I would also look and feel around the top of her mouth. And then on the bottom of her mouth too, where it's like that softer part down here, which is under the tongue, I would just push down on it and see if she's like feeling anything that's like nodes, that's like concerning. Okay, and the important part, this is where I tell the patient to open, and I would tell her, put your tongue on this side. I would check there, and on the other side. I was like, wow, very healthy. And then I would tell her to put her tongue on the roof of her mouth. And then I would just look, make sure there's nothing there. And now with the mirror, I would tell her to just like relax and stick your tongue out and say, ah. Ah. Yeah, I just want to look deep in there. And I would say, okay, go back in. And then I would use the mirror to really look in the back of like her teeth, those structures that's like, it's really hard to like detect. And then, and give the patient a break. Okay, and then for the last time, I would just like close down and just look overall, look at the lips as well on the bottom and on the top. Okay.
Two common areas that are normal, that are healthy, but that may look a little concerning is just having linea alba, which just means like it's the place where you're usually biting your cheeks. So usually there'll be just kind of like a white line there. And sometimes we can also get like petechiae, which just means like pinpoint, like little red spots, which is just your little vessels there. So that's not concerning. Mm-hmm. And then also a lot of people have bony growths, and it's called exostosis. So if you feel that, that's completely normal. It would only be concerning if maybe it was squishier rather than hard. So if you do feel something, just kind of note, like, is it tender when I'm touching it? Does it move? And then is it hard or is it squishy?
Yeah. Yeah. So it's all good. So that's how you do it yourself. Any questions about that? Yeah. Questions? Did you have a question? No question.
Okay. Thank you.
Okay. You're welcome.
Okay, so on the brochures, we have the steps. I know that was a lot.
Yeah.
And they usually test us on it, like it's a whole thing. But so you guys can always just refer back to the brochure if you guys want to practice that with yourselves.
And I think the most important places are the tongue that you can just make sure you are looking like early in the morning while you brush your teeth, just make sure that you are looking at the side of your tongue to see if there's anything new, up, down, to see if you see anything abnormal. So those are the most important places to look at. And then I'm gonna hand everyone these. You don't want to stain your shirts.
Okay, thank you. Okay, and this is just like volunteer activity. You can like watch the person next to you if you don't want to participate in the disclosing solution. It's just like fun for everyone to do. Yeah, so we're gonna give you bibs. To those who like pink, it will stain a little bit on your lips, so it'll look nice.
So it makes
She said for lipstick.
we don't have a lot. So
Who's interested in getting their teeth stained a bit?
So
Could I brush my teeth?
Yeah, we have ones here afterwards. We have ones afterwards.
we actually have 3 options. So we have this the overnight whitening daily cleanser. So if anybody here has dentures, we can go over that. If you have a child, we can also give you the kid toothbrush. We have the disclosing agent. Since there's just a little bit and we only have a few bibs, maybe 2 or 3 or how many of you guys want, we can do this. And then also we have this, it's called Super Floss. It's at Walgreens, it's really easy to buy. And this is really good for people where you're flossing, where it's either super tight or it's really open. This has, it kind of has like a squishy part in the middle, and it expands with the saliva. And so if you guys want to try this out instead of using this, since it will be a little messy, you can do that too. And then it's a lot of stuff. And then we also have the threaders. Okay, so if anybody wants to go over that with us, you
yeah,
can.
so we have different things.
So you guys can
choose which one you want
either
to
come
do.
up here and choose, and then
Yep.
that way everybody gets to experience at least one thing.
Yep.
Denture brush.
Use electric toothbrushes on your teeth. Are those worse for your teeth?
They're actually better.
They are better. Okay.
So 2 minutes of using an electric toothbrush is the equivalent of 6 minutes with a manual.
Oh,
Yeah.
okay.
Yeah.
100%.
Yeah.
Awesome.
So the only difference in terms of technique, you don't actually have to move it around. You can just let it sit there as long as it's at a 45-degree angle, and then it should do its thing.
Okay, and how long should you brush your teeth for?
2 minutes.
2 minutes.
2 minutes. Yes.
2 minutes.
So you can put either your favorite song or something, but I
Yeah, okay.
And then if you already know that you're likely to just brush once a day, we usually recommend at night. If you know that you can only commit to once a day.
Oh, at night
At
instead
night
of
is the
morning.
Most important time.
Oh, dang it.
We usually brush in the morning because we don't want to
Yeah,
smell it.
exactly.
But at night is when the bacteria works and all that.
Oh,
Also, remember that
I
from last
see.
time.
Yeah.
Yeah.
Tricky.
We said we brush in the morning with our friends. We brush at night. we brush.
So
Then we have the toothpaste so you can take it out.
How do we do the pink stuff?
oh yeah.
Oh, you want to do that?
Yeah, I
Okay.
do. Yeah.
Whoever wants to
Okay.
sit,
Yay.
sit here at the front.
Yes, I do.
Put your bib on, Shelby.
Okay.
We don't want to.
Okay.
Take as much as you want. What? You can take as much as you want.
We could probably get a phone now.
Yeah, take that out.
Okay,
Okay.
so while they're preparing that, I'll just give you guys an idea on some tips that we usually recommend for flossing. So thankfully this one is already cut, but we recommend the length of your arm. So I mean, if you have a long arm, then better, but it's usually 18 inches, if I'm not mistaken. So there's about that. So what you can do is you grab your 2 fingers and you wrap. You can either wrap the same length on both index fingers, and you want to have just about this much left.
Yeah, that's fine.
So you want it to be like this, and you want it to be tight. And then you go inside, and like they were saying, we call it the C-shape form. So you go inside you go kind of at a slant, so that way you're not cutting like straight in between. And then you hug the tooth, and then wrap up and down. And what's important is to actually go beneath the gum. So it's not just above, but just going down a little bit. And if you're not used to flossing, then it takes about a week and a half or so to not feel like it's tender, that it's bleeding. But the bleeding isn't caused by flossing, it's because there's already inflammation there. So research has shown that within 2 weeks the bleeding will go down, which means that the disease is not active. So that's the goal. Let's see. Another thing that you can do is to just wrap more on your dominant hand. So each tooth you floss, and then you wrap it onto the other side. So you have a whole new little piece of floss. And yeah, just the important part is to make sure that you're wrapping it all the way down, going below the gum line, and that it's tight enough that you feel like it's actually scraping on the side.
Yes, you're doing a great job.
Oh, can I have an extra?
You miss cute stuff.
Okay.
So usually when you do, you realize that some places are like really.
Oh wait, do you wanna move just a little bit so everyone can see?
Oh yeah.
So usually when you use this, you realize that some areas are light pink and some areas are like deep pink. The places that have a lot of pink is the place that has the bacteria and all those things hidden there. So this really helps so that you're able to see the places that you have to concentrate on more. Okay, let's wait a little bit.
And they sell
Then
them.
we can show.
They sell them in little tablets on Amazon. So with your kids as well, you can totally get them. Yeah.
So
If we have a phone and
I
we
wish
take
we
pictures.
had a bigger mirror so that we show you. I don't know if you can see.
We're gonna get a bigger one.
I know it.
Do you want to hold it so that it helps you? So you see the areas that have.
You can explain it louder.
Here. So looking at her teeth, you see these areas have like deeper pink. I don't know if you all can see it.
I have fake tooth right there.
Okay. Yep. And look here, down here. If you look here, you can see like it's more concentrated over there compared to the other areas. It's over here as well.
Yeah.
I don't know if you see it.
You wanna hold?
Yeah.
So you can see it
So
yourself.
it's usually going to be where there's a little bit of plaque and also where there's erosion because the
Yeah.
enamel is a little bit
When
thinner.
you open, open your mouth, you can see like the pink in those areas. Usually it's like the most missed area. Basically, in your case, that's your most missed area that you
Okay.
wanna, yeah.
So I'm doing pretty good.
So what we can try is that you can go brush it.
Yes.
And then we do it again and then you can see the difference.
Okay, so go brush?
Yeah.
Okay.
And then we can
Yay.
I can hold
redo
these
it
for
again.
you.
Okay, thank you. Awesome. Okay, I'll be right back.
Yeah, we'll see the improvement.
Yeah. Okay.
It's a little gauze or whatever. Okay. There's one person.
Does anyone else need a denture brush? No.
Is it good for partials?
Yeah.
It's also good for you.
And then we have these two.
You wanna, okay, she also wants to do the disclosing agent.
I know we overloaded you guys with a lot of random information. Are you guys okay with one extra additional random fact? Yeah. Okay. So there's many different types of toothpaste. Usually all of the toothpaste are gonna have fluoride. I know some people feel a little hesitant about it. Does anybody have questions about fluoride specifically? No? Okay. So most of them are gonna have fluoride, and what it helps to do is, over here, okay. Since our teeth are like bones, it's gonna have the same porous like texture, and usually that's where you're gonna feel sensitive if air goes into the little holes. So what fluoride does is protect those holes from either getting bacteria inside causing decay, or the sensitivity that your nerves are gonna feel. So depending on the toothpaste, you're gonna have fluoride combined with another ingredient that's gonna cover it even more. So I'm sure you guys have watched the ad on Sensodyne. It's like everywhere on TV. It's a little bit more expensive, and we guys brought you, so get as many as you want. But this is gonna have potassium nitrate. The ingredient, I guess the name is kind of hard to remember, but that's gonna be one of the most proven evidence-based ingredients that's going to help the most. So if you run out of this Sensodyne, if you look for potassium nitrate on as the first ingredient, then you should be good to go. So there's that. Depending on how sensitive you are, sensitivity can be caused by already having a cavity, so that would have to be addressed by a dentist. But if you feel like you're sensitive when you're just drinking something hot or something cold, usually within a week and a half of using this toothpaste, then you should be able to see some improvement with the symptoms. And we recommend flossing, and then either using the mouthwash and brushing, and then spitting out, but not rinsing with water, because we want the toothpaste to sit. And that's regardless of if it's for sensitivity or whatever thing they're promoting here. So as long as it has fluoride and then the potassium nitrate for sensitivity, you should be good to go. And then we recommend, just leaving it overnight. If you know there's a specific area that's bothering you the most, especially at the gum line, then you can just leave a dollop of it overnight, and you should notice an improvement by the next day. Yep.
When your gums bleed, that is not good.
It is not good.
And that is because you are not flossing.
Brush your teeth.
Yes, so
Like in the
that in between the
you can
tooth
look
and the
close-
gum,
closer in the
bacteria
mirror.
that's stuck in the middle.
Okay.
So by flossing, then you're able to get rid of it.
Yeah.
So there's like different levels of how. So I just it's less than.
Oh, okay. So you can see it better here. I'll hold it.
Okay.
If it's around 30%, like so if you notice like how your back.
Yes. And you see that's the area.
You see that one?
So that is the areas that you miss often.
So you have to concentrate.
Concentrate on those areas. Yeah, and those in the.
Okay. So that place currently has a lot of plaque, bacteria, and all that.
Yeah, you see like these two. Yeah.
Flossing?
Yeah.
Okay. Yeah, because I haven't had my teeth cleaned in like 7 years. But I brush every day.
And then
But
we're not gonna leave
and I
it
don't
just like
floss.
peak teeth. So
That's what
go
I do.
ahead and like brush it off.
Getting your regular cleaning is super helpful.
Yeah.
And it really depends on just how your body just takes your regular things. So some people are just more susceptible because of genetics
Right.
to cavities or periodontal loss.
Right.
So even getting your cleaning, you'll have an idea of like no genetics.